Bannansi bangi abalina ebirowoozo ebyenjawulo ku kugema okugenda okutandika olunaku olw'enkya wabula abo abaaniriza okugemebwa balina ekirowoozo nti okugemebwa kuno okugenda okukolebwa ky'ekyokuddamu ku kirwadde kya COVID-19. Wabula okusinziira ku Dr. Dirwale Alfred okuva mu minisitule y'ebyobulamu agamba nti waliwo ensonga ezitunuuliddwa 5 nga ze ziri emabega g'okugema kuno omuli ebyenfuna n'ebirala naye nga kyonna okutuula ku nfeete ekirwadde kya COVID-19 tekiriimu.
Where at this stage by vaccination we are not going to stop spread of the disease. The spread is going to continue. But we are here to vaccinate so that we limit the effect of the disease on people who are vulnerable to severe forms of the disease and who will proceed to die. I think that we need to get that very clear. Then number 2, by so doing, we expect to reduce the burden of congesting healthcare facilities.
Dr. Dirwale okuvayo bw'ati asinzidde mu musomo ogutegekeddwa minisitule y'ebyobulamu ng'erambika awamu n'okusomesa bannamawulire ku kugema kuno okugenda okukolebwa. Wabula ono ategeezezza eggwanga nga we waliwo omutendera ogugya ogw'ekirwadde kya COVID-19 era nti basanidde ogwerinda.
You know, we have flu, which is endemic here, common flu. Common flu also occurs in waves. Our wave 1 comes with the first rains. Our wave 2 comes with the second rains. And this peak superimposes itself very well on wave 2 of common cold. The first waves are starting, is it 10 days from now? 21st is equinoxes, you remember? So the rains are starting around 21st of November, of March. That's when we in the northern hemisphere should be expecting rains. And we are expecting the first common flu wave. It will not be surprising that we would not get our second wave starting with the first wave of common flu. I'm postulating this based on the character of common flu. So it is too early to celebrate, that's my point. This slide is telling us who are the people being infected. Who are the people being infected with COVID-19 in Uganda? In terms of age range, everybody is at risk. That's the point number 1. But in terms of who are the ones who are infected most, it's people between the age 20 and 50. This is where most people who are being infected are. But you know that most of our cases have been asymptomatic. So it's not surprising that our positives were being picked by social media dancing. They are positive, they are asymptomatic, and they are the majority in that age group. The younger, vibrant age group is where the epidemic is sitting. I want us to pick this very carefully because the next slide is going to give us another detail. So, if you see the people who are sick, who are getting infected, they are the people who are the most vibrant part of our society. People who are in business, people in office, people who are cultivating the most productive age, highly interactive, are the ones who get this. But we know that even if you have no symptoms, you can infect.
Ono era akoonyeko n'ebigendererwa ebyatunuuliddwa nnyo eby'abannansi okubeera nga bateekeddwa okulagayo endagamuntu ng'oli tannaba kugemebwa.
We want to secure adequate quantities of these vaccines in order to meet that target. Number 3 is to create the required awareness to generate adequate demand in order to reach the target. Number 4 is to monitor how prepared we are.
Dr. Rhoda Wanyenze omukwatula kakiiko akagema alambise ensonga lwaki ekirwadde kya COVID-19 basobodde okuzuula eddagala erikozesebwa mu kugemebwa wabula ate endwadde endala omuli ekirwadde kya mukenenya kyo eddagala terinaba kuzuulibwa. Agamba nti ensonga ya tekinologiya awamu n'enneekyusa ey'endwadde endala ze zimu ku ezo ensonga ezireetedde eddagala lino okuba nga lizuulibwa mu bwangu.
Cannot easily be recognized by the body, the immunity that we have developed. So this is the reason why. But the other reason is that we also have technology upon which the new vaccines built. Apart from two of the vaccines, the rest of the vaccines are using technology that already existed and that has been used to produce other vaccines before, like hepatitis and others. So we had that technology upon which we built to be able to make the new vaccine. Abantu
ab'okugema batandika ku myaka 18 okudda waggulu wabula nga bano bakufuna doozi 2 mu bbanga lya myezi 2. Yisa Kigongo kulwa Channel 44 Oleggulo.